A warm welcome to you all. Before we begin the session, I request Dr. K.V. Nagendra Prasad sir, Dr. Paranjyoti sir and Dr. Harini ma'am to occupy the seats. Before we begin the session, I request everyone to rise for Vande Mataram. Vande Mataram, Vande Mataram, Sujalam Sufalam, Malayaja Sheetalam, Sasya Shamalam, Mataram, Vande Shudrajosha Pulakitayamini Pullakusumita Dumadolashobini Suhasini Sumadhurabhashini Sukadam Varadam Mataram Vande Mataram Vande. Thank you everyone. It gives me immense pleasure to welcome you all to today's World Allergy Week celebration by BAC. I, Meghna, will be your host for today. For the past few days, we have come together to raise awareness about allergic diseases, discuss recent advances in diagnosis and management, and strengthen our commitment in improving the lives of individuals affected by allergies. As we gather today for the concluding session, let us reflect on the collaborative efforts required to build an allergy-aware community. With that, let's begin today's program and make the most of the final session. I now request Madhumita and team to grace the presence with an invocation song.
Namma ಗೆಲುವಾಗಿ ಬಾ ಗಜಮುಖನೇ ನೀ ನಮ್ಮ ಗೆಲುವಾಗಿ ಬಾ ಬಾಳಲ್ಲಿ ಒಂದಾಗಿ ಬಾ ನಮ್ಮ ಜೊತೆಯಾಗಿ ಕ್ಷಣ ಕ್ಷಣವೂ ನಮಗಾಗಿ ನೆರವಾಗು ಬೆಳಕಾಗಿ ಬಾಳಲ್ಲಿ ಒಂದಾಗಿ ಬಾ ನಮ್ಮ ಜೊತೆಯಾಗಿ ಕ್ಷಣ ಕ್ಷಣವೂ ನಮಗಾಗಿ ನೆರವಾಗು ಬೆಳಕಾಗಿ ದಯೆ ಇರಲಿ ನಮ್ಮಲ್ಲಿ ಗತಿ ನೀನೇ ಆದಿಯಲಿ ನೀ ನಮ್ಮ ಗೆಲುವಾಗಿ ಬಾ ಗಜಮುಖನೇ ನೀ ನಮ್ಮ ಗೆಲುವಾಗಿ ಬಾ.
Thank you team, that was melodious. Now I invite Kirtana to welcome the gathering.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ವಿಶ್ವ ಅಲರ್ಜಿ ವಾರದ ಈ ಸಮಾರೋಪ ದಿನದ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವ ಎಲ್ಲ ಗಣ್ಯ ಅತಿಥಿಗಳು, ವೈದ್ಯರು, ಆರೋಗ್ಯ ಸೇವೆ ಪಡೆಯುತ್ತಿರುವವರು, ಅವರ ಕುಟುಂಬದ ಸದಸ್ಯರು, ನಮ್ಮ ಸಿಬ್ಬಂದಿ ವರ್ಗ ಹಾಗೂ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಕಾಳಜಿ ಹೊಂದಿರುವ ಎಲ್ಲರಿಗೂ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತ. ಕಳೆದ ಕೆಲವು ದಿನಗಳಿಂದ ನಾವು ವಿಶ್ವ ಅಲರ್ಜಿ ವಾರವನ್ನು ಅರ್ಥಪೂರ್ಣವಾಗಿ ಆಚರಿಸುತ್ತಾ ಅಲರ್ಜಿ, ಪರಿಸರ ಮತ್ತು ಆರೋಗ್ಯದ ನಡುವಿನ ಸಂಬಂಧವನ್ನು ವಿವಿಧ ದೃಷ್ಟಿಕೋನಗಳಿಂದ ಅರಿಯುವ ಪ್ರಯತ್ನ ಮಾಡಿದ್ದೇವೆ. ಈ ವಾರದ ಪ್ರತಿಯೊಂದು ಕಾರ್ಯಕ್ರಮವು ನಮಗೆ ಹೊಸ ಅರಿವು, ಹೊಸ ಚಿಂತನೆ ಮತ್ತು ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಹೆಚ್ಚಿನ ಜಾಗೃತಿಯನ್ನು ನೀಡಿದೆ. ನಿನ್ನೆ ನಾವು ಆರೋಗ್ಯ ಕ್ಷೇತ್ರದಲ್ಲಿ ಹವಾಮಾನ ಬದಲಾವಣೆಯ ನಿರಂತರ ಸವಾಲುಗಳು ಎಂಬ ವಿಷಯದ ಕುರಿತು ಚರ್ಚಿಸಿದೆವು. ಹವಾಮಾನ ಬದಲಾವಣೆಯು ಆರೋಗ್ಯ ವ್ಯವಸ್ಥೆ, ಸಾರ್ವಜನಿಕ ಆರೋಗ್ಯ ಮತ್ತು ವ್ಯಕ್ತಿಗಳ ಜೀವನದ ಮೇಲೆ ಉಂಟು ಮಾಡುತ್ತಿರುವ ಪರಿಣಾಮಗಳನ್ನು ನಾವು ಅರ್ಥ ಮಾಡಿಕೊಂಡೆವು. ಪ್ರಕೃತಿಯಲ್ಲಿ ನಡೆಯುತ್ತಿರುವ ಬದಲಾವಣೆಗಳು ಈಗ ನಮ್ಮ ಆರೋಗ್ಯದ ಭಾಗವಾಗಿವೆ ಎಂಬ ಸತ್ಯವನ್ನು ನಾವು ಮತ್ತೊಮ್ಮೆ ಮನಗಂಡೆವು. ಇಂದು ಈ ವಾರದ ಸಮಾರೋಪ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ನಾವು ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿ ಮತ್ತು ದೇಹದ ರಕ್ಷಣಾತ್ಮಕ ಕವಚಗಳ ಮೇಲೆ ಹವಾಮಾನ ಬದಲಾವಣೆಯ ಪರಿಣಾಮಗಳು ಎಂಬ ಅತ್ಯಂತ ಮಹತ್ವದ ವಿಷಯದತ್ತ ಗಮನ ಹರಿಸುತ್ತಿದ್ದೇವೆ. ಈ ವಿಷಯವನ್ನು ಅರ್ಥ ಮಾಡಿಕೊಳ್ಳುವುದು ಕೇವಲ ವೈಯಕ್ತಿಕ ದೃಷ್ಟಿಯಿಂದ ಮಾತ್ರವಲ್ಲ, ನಮ್ಮ ದೈನಂದಿನ ಬದುಕಿನ ದೃಷ್ಟಿಯಿಂದಲೂ ಬಹಳ ಮುಖ್ಯವಾಗಿದೆ. ನಮ್ಮ ಆರೋಗ್ಯವನ್ನು ಕಾಪಾಡಿಕೊಳ್ಳಲು ಮುಂದಿನ ಪೀಳಿಗೆಗಳಿಗೆ ಆರೋಗ್ಯಕರ ಪರಿಸರವನ್ನು ಒದಗಿಸಲು ಮತ್ತು ಅಲರ್ಜಿ ಸೇರಿದಂತೆ ಅನೇಕ ಆರೋಗ್ಯ ಸಮಸ್ಯೆಗಳನ್ನು ಕಡಿಮೆಗೊಳಿಸಲು ಈ ಅರಿವು ಅಗತ್ಯವಾಗಿದೆ. ಇಂದು ಈ ವಾರದ ಕೊನೆಯ ಕಾರ್ಯಕ್ರಮವಾಗಿದ್ದರೂ ಇಲ್ಲಿ ಪಡೆಯುವ ಜ್ಞಾನ ಮತ್ತು ಪ್ರೇರಣೆ ಮುಂದಿನ ದಿನಗಳಲ್ಲಿಯೂ ನಮ್ಮೊಂದಿಗೆ ಮುಂದುವರಿಯಲಿ ಎಂಬುದು ನಮ್ಮ ಆಶಯ. ಮತ್ತೊಮ್ಮೆ ವಿಶ್ವ ಅಲರ್ಜಿ ವಾರದ ಸಮಾರೋಪ ದಿನದ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತ. ಧನ್ಯವಾದಗಳು.
Thank you, Kirtana. A warm welcome to you too. Today we have Dr. Harini, who is a valued member of our own institution, serving our patients with dedication and expertise as the speaker of the session, Climate Change, Effects on Immunity and Barrier Defense. I now invite Lavanya to introduce the speaker.
Good evening everyone. It's my great pleasure to introduce our speaker for today's session, Dr. Harini. She is a highly skilled ENT specialist with extensive experience in the diagnostic and management of the ear, nose and throat disorder. She has completed her MBBS from the KS Hegde Medical Academy, Bangalore, followed by her MS in the otorhinolaryngology from the MBJ Medical College and Research Hospital, Oscote. She has built a strong clinical career through her experience at Manipal Hospital, Narayana Multi-Speciality Hospital, Apollo Spectra Hospital, providing comprehensive high-quality patient care. Her clinical expertise includes advanced ENT procedure, endoscopic ear surgeries, sinus surgeries and facial plastic surgeries, especially in the open and closed spectorhinoplasty. Beyond her clinical practice, Dr. Harini has actively contributed to her academies through paper presentation at state and national conference. In addition, she has completed advanced training in the artificial intelligence in the healthcare, reflecting her commitment to the innovation in the modern science. Today, Dr. Harini will be addressing us on the topic climate change effect on immunity and barrier defense. This session will highlight impact of the climate change on the human health, immunity and the body's natural barrier defense, while emphasizing the importance of awareness and preventive care. We are delighted to have her with us today to share her expertise and insights. I request you all to give her warm welcome with applause.
Thank you, Lavanya. Now I request Dr. K.V. Nagendra Prasad sir and Dr. Paranjyoti sir to present a moment of appreciation to Dr. Harini ma'am. Thank you, sir. Now I invite a valued speaker to address us on the topic.
Good evening, everyone. I hope I'm audible behind. Yes, please. No? Okay. So we have had a wonderful week of enlightenment. Yeah? So we were fortunate enough to have experts, stalwarts, ignite our minds with their knowledge and expert knowledge. So for today's topic, my topic is climate change effects on immunity and the defense barrier. So I'd like to start by drawing your attention to the word immunity. What does the word immunity mean? Anyone here? One word, anything? A sentence?
Defense of body.
Yes, exactly. So immunity means defense, like how our country has a defense system. The army, the navy, the air force, our bodies have the defense system, which is the immune system. So we have two types of immune system. One is called the innate immune system and the other one is the adaptive immune system. The innate immune system, as the name itself suggests, is something that we're born with. And the adaptive immune system is something that we build over our lifetime. The immune system has different components, different barriers. Barriers mean something that's blocking it. So we have physical barriers, we have chemical barriers and cellular barriers. Physical barriers are three types: the skin, the mucous membrane and the cilia. So skin is something that protects us from anything in the outside environment. When the skin has tight junctions that hold two cells together. So this inhibits anything from the outside to enter inside. The mucous membrane, on the other hand, is something that lines the inside of your cavities from the inside body. So what this does is it secretes mucus. Mucus is nothing but a thick secretion. This helps in trapping the invaders for any foreign substance and destroys it. Then we have cilia. Cilia is fine hair-like projections that are present in the inside cavity. So what this does is it slowly moves. This is specialized in motility. It slowly moves around in a specific direction to push out any invaders that are coming inside. Then we have chemical barriers. Chemical barriers in the form of tears, saliva, sweat, all of this have chemicals like chemical enzymes like lysozyme, which destroy anything that's entering inside. Okay. Then we have cellular barriers. These are specialized immune cells that are present all over the body and that help in fighting anything that's entering the system. Now, how does all of this immune system start off? So when we're inside the womb, like the baby's inside the womb, before even being born, it's a sterile environment. It is protected by the mother. And any immunity that it gets from there is through the placenta. The mother's antibodies and the mother's immune cells protect it from any infection, anything that comes across. And through the 9 months, 3 trimesters, by the time the baby comes out at birth is when the innate immunity is formed. That is the skin, the cilia, the mucous membrane. So at birth, this is like a baseline immunity that anyone has. Only the physical, chemical barriers and the cellular barriers. From birth up until 6 months of age, the baby is exclusively breastfed. So it gets a little more immune cells from the mother's milk, immunoglobulins that are secreted through the breast milk and then goes to the baby. So this is well protected up until 6 months of age. Slowly, at the end of the 6 months, all of this wears off. The maternal protection, immunity, everything wears off. Then what we're left with is slowly after 6 months of age, the baby starts exploring the outside world, slowly starts walking, crawling. We start to introduce solid food. This is the best time from 6 months of age to 3 years of age when they're exposed to different kinds of bacteria, different kinds of germs, different kinds of food, and slowly the adaptive immunity starts to build. During this time, this is the best time to allow them to explore more. So the more diverse it is, the more the immune system learns what to accept and what not to accept. During this time, a one-off time when you can fall sick, when you have a small stomach upset or fever or an infection is totally fine, because this actually it improves the immune system. It boosts the immune system. But apart from that, there are kids who are started off early in preschool. So here what happens is there are many kids that are in the preschool, quite a few of them, and suddenly from a very protective environment, they're brought into an environment where they have all the pathogens, they're exposed to multiple people. One kid gets sick, you know how it goes from one kid to the other kid, and before this kid recovers, we're back to the same kid again getting sick. So to prevent this, it's the best to slowly include them in preschools. The first, start them with a few hours in a couple of weeks, then a few days, then a few weeks, and then continuously start school from post 5 to 6 years of age. So apart from all of this that's protecting us, if an antigen or a foreign substance enters the body, what happens? So when this enters the body, it starts to destroy cells. When this happens, the body triggers chemicals like histamine. It's like a trigger, like an alarm signal. The chemicals then further the blood vessels, it helps in dilating them, so that more immune cells, more antibodies can reach the site of the infection or the invader, and helps in destroying this. But suppose the innate immunity is working on it and is not able to destroy it, then it triggers the adaptive immunity. The adaptive immunity has different cells, B cells and T cells. So B cells are cells that are derived from the bone marrow, and T cells are derived from the thymus. So these are more specific. They have memory cells. So once they come across any foreign substance, any viruses, bacteria, they tend to remember it the next time they come in. So they secrete antibodies. These antibodies also reach the site and help in destroying the invaders. Now, how does climate change affect all of this? This is how we know that a normal immune system works. How does climate change affect any of this? What happens when there's increase in temperature? When there's increase in temperature, the tight junctions that keep the two cells together starts to separate a little bit. It allows more gap for pathogens to come inside. That is one thing. Next is humidity. Decreased humidity. What happens when there's decreased humidity? That means there is decreased moisture in the air. So when there's decreased moisture, the mucous membrane is not able to secrete enough mucus to trap the pathogens. Also, it does not, the cilia, the movement of the cilia also gets affected. And air pollution. Air pollution, we have carbon dioxide, carbon monoxide, sulfur dioxide, nitric oxide. What does all of this do? It directly destroys the cells, whether it is the lining of the skin, the mucous membrane, or even the gut. So despite all of this, we also have microbiota. That means normal bacterial flora that's present in the gut. There are trillions of them present on the skin and present in the gut that help with protection. So when there is extreme weather, whether it's extreme cold, extreme heat, it destroys these bacteria as well. These bacteria produce short-chain fatty acids which help us with the immune system, building the immune cells. So if these bacteria get destroyed, then it also decreases your immunity. Then with extreme temperature, also the white blood cells, the ones that help us fight any infection off, decreases with time. And their efficiency in fighting off any infection also decreases. And due to extreme weather, we also have alterations in the pH. So the normal bacterial flora gets destroyed. Next, so how do we overcome all of this? One is fossil fuels. Burning of fossil fuels, petrol, coal, gas, all of this secretes carbon dioxide, carbon monoxide, sulfuric acid. So reduction of all of this. Then regular emission tests. So we have, I think at least what we have here is once in 6 months we do emission tests to reduce all of that. Then garbage, waste products, proper disposal of waste products. Accumulation of these waste products start to create a damp environment. So we all know when there's a damp environment, it's the best environment for fungus to grow. This dispenses fungal spores in the air. Anything, the dust mites, fungal spores, bacteria, all of this can cause an hyperreactive immune system. Now, apart from all of this, also the normal biodiversity has decreased. Like the normal flora, fauna, normal bacteria that's supposed to be present in our environment is decreased because of this extreme weather. So because of this, our tolerance also decreases. When our tolerance decreases, the immunity derived due to this tolerance also decreases, and that's how we come up with allergies. So what else can we do apart from that? Food-wise, we all have heard eat nutritious food that will help our immune system. What kind of food? We have something called pre and probiotics, which is prebiotics means probiotics is bacteria, normal bacteria that help our gut. This is rich in anything that's fermented, curd, fermented rice, your normal idli, dosas, normal staple food. Then comes prebiotics. Prebiotics are fibers that are insoluble to us, but they are fed as their food. They're like food for the good bacteria in your stomach. So what is rich in these prebiotics? Bananas, oats, ragi, and millets, all of this is rich in the prebiotics. So a combination of all of this will help boost our immunity. And apart from this, what can we do about the environment? The green spaces. We'll have to increase the green spaces. But having said increasing the green spaces, that doesn't mean that there are certain plants and trees that have pollens that cause multiple allergies, starting from the eyes, redness of the eyes, watering, itching. That's called allergic conjunctivitis. Then comes the nose block, running nose, sneezing, allergic rhinitis. Then going down to further the lower respiratory tract, it also causes symptoms like cough, wheezing, breathlessness, and also of course it affects the gut. People have indigestion, burning sensation, not able to digest, vomiting, nausea, or they're not able to get enough nutrients because of this. So the next step would be, so increasing the biodiversity as well, but we do have these pollens. In case there are ones that are causing these symptoms, then we cut down on those trees. Recently we came across a tree with the pollens called Conocapata erecta. So these ones were found to have caused major allergies in people. So in some of our states, they are either restricted or prohibited completely. So we'll have to keep in mind while planting more trees, as much as it helps us, it also can cause these allergies if they are pollens that are virulent. Now with the increase in temperature, the pollen season also increases. The number of pollens that are dispensed in the air also increases, and it also causes increased virulence because of this. But compared to before, why do we have this increased temperature now? We have all heard of the term global warming. The earth is getting heated up. Why? Because we're using all these fossil fuels, petroleum, coal, gas that emit sulfur dioxide, carbon monoxide, which is getting trapped in the atmosphere and increasing the temperature. So we can cut down on those things, and also cutting down on all of this will help improve the climate. But now when it comes to an individual level, how do you protect yourself from existing pollens that are there, existing dust, existing mites that are there? One is to use a mask. A regular mask will help with the dust mites and a few pollens, but particulate structures that cause air pollution, we also have a carbon activated mask that will help with it. And anyone has any suggestion about how to improve our climate, environment? Sorry?
Air filters.
Air filters, yeah, that's a good one. That will help. What about food-wise, building immunity? How else do we do that? Anyone has any suggestions, any questions about food? Yes. So that again, we are using the same staple food as our ancestors, parents, grandparents, but for some reason the nutritional value is different as it was then and now. The reason for that is the crops that are that are grown now are either the soil is polluted or the water is polluted, or there's way too many pollutants in the atmosphere in itself. So because of this, even the crops that get the yield, the nutritional value is not the same as it was before. So yes, organic farming will also help. Anything else? Anyone? No? Any questions? No?
So how do we measure improvement in immunity once we start using organic?
There's no particular way to measure it as far as I know, but it depends on how you feel. If you feel healthy enough and you see an improvement in yourself, that's one thing.
What is, other than
going for organic, it's economically challenging at times. So one simple way that everybody can follow that will build up their immunity.
You could grow a few crops in your own houses. That would help economic-wise both ways.
Organically, just in everyday life, what is that we can do that everybody can do that will improve our immunity?
Okay, that way I think exercise helps, regular exercise, because it increases the blood flow in the body from top to bottom, so it washes out all the toxins. And few normal things like doing yoga, meditation, because stress these days is a big factor. It's impossible to say don't get stressed, it'll improve your immunity. So different ways to manage your stress. What happens when you're stressed is a hormone called cortisol is released. So in small doses, in small boosts, when this cortisol gets released, it's a booster. It boosts your activity just before an exam, just before an interview, just before a competition. It helps in boosting it. But what happens when long-term stress and long-term cortisol is, it's increased in your body for a long term? Then your immune system gets overwhelmed, it gets tired, and slowly chronic inflammation develops and you start getting conditions, metabolic conditions. Like I think everyone's heard of something called PCOD, polycystic ovary disease. It's a huge burden. 1 in almost every 3 or 5 women have it. And for the longest time, they've not found out an exact cause for it. They've asked women to diet, use proper food, nutritious food, exercise, and all of that, and reduction of weight. But if you see, even after, there are many women who are not overweight, and they still have that as well. So it's something that affects you from head to toe. It looks like a simple thing, but food, water, rest, exercise, and managing stress improves a lot of your health.
So I have just one doubt, like
Yeah.
is allergy like kind of related to immunity? If someone having low immunity, they are going to get allergy.
Yeah, if your defense system is lower, then you do have a tendency to get an infection, to allow an allergen inside.
So is there like some way people who are more allergic can focus and improve their immunity so that they can be like, I don't know.
See, if okay, if you're someone who already has allergies, then one is to find out the exact cause. For the longest time, we've been treating symptoms, like if you have allergies or if you have a running nose, nose block, cough, sneeze, we've been treating the symptoms. So you think you can take the medications, you wait for some time, then it comes back, then you take medications, again it comes back. The way to do it is find the cause. So we have various tests here where we do try and find the cause, and then we prepare a vaccine from the same thing and give it so that your immune system learns to tolerate whatever is present in the air. The concept of it is, if there are 100 pollens around you, there are 5 of us sitting here and nothing happens. But you start sneezing, coughing, that means your immune system is not able to take even that 100 that everyone else around you is able to take. So the solution to that would be to give you 1 pollen every day so that you build your tolerance and you also stop reacting just like everyone else around you. And in addition to that, of course, when you say your immunity is low, again, simple things like food, your stress, your exercise, ample amount of water, 2.5 liters in a day, all of this helps. It looks very silly when I say it's just food, it's just exercise, but this makes a lot of difference. Any other questions? No?
Thank you, ma'am, for your insightful session. I think most of us will be greatly benefited by your valued perspective. Any questions again? Any remaining questions? Okay. As now we've reached today's end of today's program, I request Swati to propose vote of thanks.
evening everyone. As we come to the conclusion of last day of Allergy Week 2026, it's my privilege to propose vote of thanks. On behalf of the organizing team, I extend my heartfelt gratitude to Dr. Harini for sharing valuable insights on climate change effects on immunity and barrier defense. I sincerely thank our respected faculty members and dignitaries for their constant support, encouragement and presence throughout this week. Your guidance has been instrumental in making this event meaningful and successful. I express my heartfelt gratitude to our sponsor, Lupin Limited, for sponsoring refreshment for today's event. I would also like to acknowledge the tireless effort of the organizing committee, volunteers, technical team and support staff. Behind every successful event is a committed team, and your hard work deserves sincere appreciation. Finally, I thank all the participants for your active involvement and keen interest throughout the Allergy Week 2026. Your engagement has made this program truly rewarding. Thank you.
Thank you, Swati. Thank you everyone for your enthusiastic participation throughout World Allergy Week. I extend my heartfelt gratitude to everyone who have contributed. So this comes to an end of the World Allergy Week celebration. Thank you everyone for making it a grand success. Before we conclude, I request everyone to join us for the national anthem.
जनगणमनाधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मा